Have you ever wondered why most people over the age of 75 succumb to a few common causes of death? What are the main risks that significantly impact our health as we age? As we get older, our bodies undergo significant changes, making us more vulnerable to certain health conditions. But the good news is that many of these risks can be prevented or managed with the right knowledge and lifestyle choices. After the age of 75, a staggering 99% of deaths are linked to just 5 major causes. Understanding these causes, knowing how they develop, and most importantly, learning how to avoid or minimize these risks can help you take control of your health and live a longer, more fulfilling life. In this video, we'll explore these 5 key causes and offer practical advice on how to stay healthy and thrive well into your senior years. By the end, you'll have the tools to reduce your risks and enjoy better health in your later years. 1. Heart disease, the leading killer. After 75, heart disease remains the #1 cause of death among older adults. In fact, more than 30% of all deaths in individuals over the age of 75 are attributed to heart disease, which includes conditions such as coronary artery disease, heart attacks, heart failure, and arrhythmias, irregular heart rhythms. The risk of developing heart disease increases as we age, and several factors play a role, such as family history, high blood pressure, high cholesterol levels, smoking, and obesity. How heart disease develops. Heart disease typically begins with damage to the blood vessels or heart valves. Over time, plaque can build up in the arteries, a process known as atherosclerosis, which narrows the blood vessels and restricts blood flow to the heart. This leads to reduced oxygen supply to the heart muscle, resulting in chest pain, heart attacks, or heart failure. High blood pressure, hypertension, can further damage the blood vessels, increasing the chances of heart disease. How to prevent heart disease? Adopt a heart-healthy diet. The food you eat plays a crucial role in heart health. Focus on consuming a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Healthy fats such as those found in nuts, seeds, avocados, and fish, particularly fatty fish like salmon, are essential for maintaining a healthy heart. Limit saturated fats, processed sugars, and high-sodium foods, all of which contribute to heart disease. Exercise regularly. Physical activity helps to strengthen the heart, reduce blood pressure, lower cholesterol levels, and maintain a healthy weight. Aim for at least 150 minutes of moderate aerobic exercise each week, such as brisk walking, cycling, or swimming. Strength training exercises are also beneficial for overall health and muscle maintenance. Monitor blood pressure and cholesterol levels. Regularly check your blood pressure and cholesterol levels. If your blood pressure is elevated, follow your healthcare provider's advice for managing it, including lifestyle changes and medications if necessary. Low-density lipoprotein, LDL, cholesterol, or bad cholesterol should be kept at a healthy level to reduce plaque buildup in the arteries. Avoid smoking and limit alcohol consumption. Smoking is one of the leading risk factors for heart disease. Quitting smoking at any age can significantly reduce the risk of heart attacks and improve overall health. Similarly, excessive alcohol intake can raise blood pressure and increase the risk of heart disease. Limiting alcohol consumption to moderate levels is crucial for heart health. If you're still watching the video and finding these insights valuable, please comment below to let me know you are here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any video. Your support helps us continue creating good video to inform and inspire you. Now let's go forward. 2. Cancer, the silent threat that grows with age. Cancer is the second leading cause of death in those over 75, and its incidence increases as people age. In fact, Around 77% of all cancers are diagnosed in individuals aged 55 or older. The risk of developing cancer rises due to various factors, such as genetic predisposition, long-term environmental exposures, including smoking and alcohol use, and weakened immune systems that are less efficient at identifying and attacking abnormal cells. Most common cancers in seniors. Some of the most common cancers that affect older adults include lung cancer. Often associated with smoking, lung cancer is the leading cancer killer for both men and women in older adults. Prostate cancer. This is the most common cancer in men over 75, but it tends to grow slowly and may not significantly impact life expectancy in some cases. Breast cancer. While more common in younger women, the risk of breast cancer increases with age, especially in women who have a family history of the disease. Colorectal cancer. Colorectal cancer, cancer of the colon or rectum, is also more common in older adults, especially those with a history of inflammatory bowel disease or a family history of colorectal cancer. How to prevent cancer. Avoid tobacco products. Smoking is the leading cause of lung cancer, and it also contributes to cancers of the mouth, throat, bladder, kidney, and more. If you smoke, quitting is the most important step you can take to reduce your cancer risk. Eat a healthy, balanced diet, a diet rich in fruits, vegetables, whole grains, and lean proteins is crucial for cancer prevention. Foods high in antioxidants, such as berries, leafy greens, and nuts, help protect cells from damage that can lead to cancer. Limit your intake of processed meats and alcohol, as these have been linked to an increased risk of certain cancers, including colorectal and liver cancer. Regular cancer screenings. Early detection is key to improving cancer survival rates. Many cancers can be detected early through regular screenings, such as mammograms for breast cancer, colonoscopies for colorectal cancer, and prostate exams for men. Talk to your doctor about the appropriate screenings based on your risk factors and age. Exercise and maintain a healthy weight. Regular physical activity can lower the risk of several types of cancer, including breast, colon, and endometrial cancers. Maintaining a healthy weight through diet and exercise reduces the strain on your body and lowers your risk of developing obesity-related cancers. 3. Stroke, a sudden and devastating threat. Stroke is another major cause of death and disability among older adults. A stroke occurs when blood flow to a part of the brain is interrupted, either due to a blockage, ischemic stroke, or the rupture of a blood vessel, hemorrhagic stroke. Stroke can lead to brain damage, which can cause paralysis, speech difficulties, and cognitive decline. The risk of stroke increases significantly with age, especially in individuals with high blood pressure, heart disease, diabetes, or a history of smoking. How stroke happens. In an ischemic stroke, a clot or atherosclerotic plaque blocks the blood flow to the brain, depriving brain cells of oxygen and causing them to die. In a hemorrhagic stroke, a blood vessel in the brain bursts, leading to bleeding in the brain. Both types of strokes result in severe and often permanent damage to the brain and can be fatal if not treated quickly. How to prevent stroke. Manage high blood pressure. High blood pressure is one of the leading causes of stroke, so it's important to monitor your blood pressure regularly and take steps to keep it within a healthy range. This may involve lifestyle changes such as reducing salt intake, exercising regularly, managing stress, and taking prescribed medications. Control diabetes and cholesterol levels. People with diabetes or high cholesterol are at higher risk for stroke. Keeping blood sugar and cholesterol levels within the recommended range can help reduce your stroke risk. Maintain a healthy lifestyle. Regular exercise, a balanced diet, and avoiding smoking and excessive alcohol consumption can significantly reduce the risk of stroke. Managing stress through relaxation techniques such as yoga, meditation, or deep breathing exercises also helps. Recognize stroke symptoms. Fast treatment is crucial for minimizing brain damage after a stroke. Be familiar with the warning signs of a stroke, which include sudden numbness or weakness on one side of the body, confusion, difficulty speaking, and vision problems. If you experience any of these symptoms, seek medical attention immediately. 4. Chronic respiratory diseases. Chronic respiratory diseases, such as chronic obstructive pulmonary disease, COPD, emphysema, and chronic bronchitis, are major causes of death in people over 75. These conditions are often caused by long-term smoking, exposure to environmental pollutants, and respiratory infections. As we age, the body's ability to repair and regenerate lung tissue decreases, making older adults more susceptible to these conditions. How respiratory diseases develop COPD is a progressive disease that causes inflammation in the airways and damage to the lung tissue, which leads to difficulty breathing, chronic cough, and wheezing. Emphysema, a type of COPD, occurs when the air sacs in the lungs become damaged, reducing the lungs' ability to transfer oxygen into the bloodstream. Chronic bronchitis, another form of COPD, involves inflammation of the bronchial tubes, leading to mucus production and coughing. How to prevent respiratory diseases. Quit smoking. Smoking is the primary cause of COPD and emphysema. Quitting smoking, even in your later years, can slow the progression of the disease and improve your quality of life. Non-smokers should avoid exposure to secondhand smoke. Limit exposure to air pollutants. Environmental pollutants and allergens can exacerbate respiratory diseases. If you live in an area with high levels of air pollution, limit your time outdoors on high-pollution days. Ensure good ventilation in your home and avoid exposure to toxic fumes. Exercise and stay active. Regular physical activity can help maintain lung function, improve stamina, and reduce shortness of breath. Aerobic exercises such as walking, swimming, or biking can be beneficial. Breathing exercises such as diaphragmatic breathing and pursed lip breathing can also help improve lung capacity. Get vaccinated. Respiratory infections such as the flu and pneumonia can make chronic lung diseases worse. Make sure to get vaccinated against these infections, particularly if you have a history of lung disease. 5. Alzheimer's disease and other dementias. Alzheimer's disease and other forms of dementia are devastating conditions that affect millions of older adults. These diseases cause a progressive decline in memory, thinking, and behavior, making it difficult for individuals to care for themselves and leading to a reduced quality of life. Alzheimer's disease, in particular, is the most common form of dementia and is characterized by the accumulation of abnormal proteins in the brain that impair brain cell function. How dementia develops. Dementia typically begins with mild memory loss and confusion, but gradually progresses to more severe cognitive impairments. Alzheimer's disease is the most common cause of dementia, but other conditions, such as vascular dementia, caused by poor blood flow to the brain, Lewy body dementia, and frontotemporal dementia, can also cause similar symptoms. How to prevent dementia. Stay mentally active. Engaging in activities that stimulate the brain, such as reading, puzzles, or learning new skills, helps keep cognitive functions sharp. Regularly challenging the brain has been shown to delay the onset of dementia or reduce its severity. Exercise. Regularly, physical activity is important for brain health. Exercise increases blood flow to the brain and can reduce the risk of cognitive decline. Activities such as walking, swimming, or yoga help maintain brain function. Eat a brain-healthy diet. A diet rich in antioxidants, healthy fats, and essential nutrients supports brain health. The Mediterranean diet, which includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats, is particularly beneficial for preventing cognitive decline. Stay socially active. Social engagement has been shown to reduce the risk of dementia. Maintaining relationships, participating in group activities, and staying connected with friends and family can all help protect the brain from cognitive decline. Aging is a natural part of life, but it doesn't have to be synonymous with disease or decline. By understanding the leading causes of death after 75 and taking proactive steps to manage our health, we can reduce the risks and improve our chances of living longer, healthier lives. Heart disease, cancer, stroke, chronic respiratory diseases, and dementia are the primary threats to health in older adults, but they are not inevitable. By adopting healthy habits like eating a balanced diet, staying active, managing stress, avoiding smoking, and regularly seeing a healthcare provider, you can protect yourself against these conditions. The key to a long, fulfilling life lies in prevention, early detection, and maintaining an overall sense of well-being. Take charge of your health now, and you can enjoy your later years to the fullest. Your future self will thank you.